everyone, I am Timmy Grace, and today, let's talk about a mysterious and life-threatening condition that can strike without warning during childbirth, called amniotic fluid embolism, or AFE, a rare condition that we must know about. So, what happens when something that's meant to protect the baby turns into danger for the mother? Let's find out. AFE is a sudden, unpredictable emergency that occurs when amniotic fluid, yes, the very fluid meant to cushion and protect the baby, enters the mother's bloodstream. Instead of nurturing life, it triggers a catastrophic response in the mother's body. In this video, we'll talk about its causes, what are the risk factors, signs and symptoms, management, and prognosis. This typically happens when amniotic fluid is forced into open uterine blood sinuses, often after membrane rupture or partial premature separation of the placenta. But recent studies suggest it's not just a physical blockage, it's also a humoral or anaphylactoid reaction, almost like a severe allergic response within the maternal circulation. And here's the scariest part. There's no warning. One moment, the mother is stable, and the next, she's in critical danger. AFE can strike at any time, during labor, delivery, or even in the immediate postpartum period. Although AFE can happen without any warning, some risk factors make it more likely. First, advanced maternal age. Next, multiple pregnancies like twins or triplets. Another is placenta previa, or the abruptio placenta. Another risk factor is having a cesarean delivery or experiencing uterine trauma. But don't be fooled, it can still happen even when none of these are present. Basically, anything that allows amniotic fluid to enter the bloodstream can trigger it. But remember, it can also happen in women with no risk factors at all. For its signs and symptoms, picture this. A woman, usually in the active phase of labor, sits up suddenly and grasps her chest because of pain, sharp pain, and inability to breathe as pulmonary artery constriction occurs. She becomes pale and then turns the typical bluish gray associated with amniotic fluid embolism and lack of blood flow to the lungs. Within minutes, she could be unconscious, and her fetus is put in danger as placenta blood circulation halts. Now, the question is, how can we manage it? There's no cure, but immediate action can save lives. Management is all about supportive care. The immediate management is oxygen administration by face mask or cannula. Within minutes, she will need CPR. However, CPR may be ineffective because these procedures do not relieve the pulmonary constriction. Blood still cannot circulate to the lungs, and that may occur within minutes. Now, for its prognosis, it depends on the size of the embolism, the speed with which the emergency condition was detected, and the skill and speed of emergency interventions. Sadly, AFE has a high mortality rate, but survival is possible, especially with fast recognition and emergency care. There's no guaranteed way to prevent it, but delivering in a facility with trained professionals and access to ICU support gives the best chance. In nursing, we are more than caregivers. We are lifelines in the most critical moments. AFE may be rare, but when it strikes, it demands every bit of knowledge, skill, and heart that we bring into the delivery room. So, let's take what we've learned today, keep it in our hearts and hands, and remember, in one emergency, one decision, one act of courage, you could be the reason a mother gets to hear her baby cry. And I'm gonna leave you with this quote, saying, in a chaos of crisis, a prepared nurse becomes a calm force of hope. Thank you and have a good day.